See, I don't need no reason, 'cause you provide the healing. There was some hard times.
You are listening to a live broadcast from Radio Al Ansar, Pietermaritzburg, 105.6 FM.
To the time to teach us, so that the guidance reach us, and you know it will. محمد يا رسول الله صلى الله محمد يا رسول الله صلى عليك وسلم المولى محمد عليك وسلم المولى محمد. Look up to the best of the men, and I'm working on the test to the end. By following the message he sent, and try to indeed the lesson.
A'udhu billahi minash shaitanir rajeem. Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh to our listeners on this Saturday morning on Radio Al Ansar 90.4 MPT Marisburg 105.6 FM. I am Shubnum Ismail on the PMB Pulse show, capturing the heartbeat of our community. And today we are talking about something that's stealing years from us quietly, our silent killers. We are going to be talking about diabetes, hypertension, TB, HIV and AIDS, and of course, heart failure. You don't feel them coming. No pain, no warning, until one day it's too late. But there is good news. They are preventable. They are controllable. With the right screening, early detection, and a few lifestyle changes, we can add healthy years to your life. And today we are not stopping there. We'll also talk general internal medicine, the everyday things affecting your body from head to toe, plus why early cancer screening can be the difference between a scare and a second chance. So if you have been putting off that blood pressure check, that sugar test, or you just want to understand your health better, you have tuned into the right show. So stay with me for the next hour. Joining us on the Pietermaritzburg Pulse show is a doctor who's been serving our community for over 38 years. Dr. Akoo, Assalamu alaikum wa rahmatullahi wa barakatuh. It's great to have you at Ansar Pietermaritzburg studio.
Wa alaikum salam. Assalamu alaikum to the listeners.
Listeners, Dr. F.M. Akoo is a highly experienced general practitioner who began his career at Edendale Hospital, rising to become Registrar of Internal Medicine. His dedication to patients even earned recognition from the Department of Health. So since 1996, Dr. Akoo has run his own practice, focusing on silent killer diseases such as hypertension, heart failure, tuberculosis, HIV, and even cancer. He's also passionate about screening and early detection because catching these conditions early can change everything for your quality of life. A graduate of the University of Jammu and Kashmir on a United Nations scholarship, Dr. Akoo also led the Gateway Clinic at Edendale during the COVID-19 pandemic. His experiences are captured in the upcoming poetry memoir, Breathe, written by his wife, Adila Akoo. Inshallah, we'll probably have on a show sometime. Doc, we are really glad to have you with us today, so let's dive straight into conversation. Let's tackle diabetes. So can you tell us, are you seeing an increase of diabetes cases at your practice or newly diagnosed cases on an increase?
Unfortunately, there is a sudden increase in diagnosis of new patients in the young age group, and it is a burning topic at the moment. If we look at it from a South African perspective, South Africa has the highest incidence of diabetes, hypertension, and coronary artery disease in the world. Now, America sits with a population with obesity at around 50%. That's one of the leading predisposing causes to diabetes. Hence, we are now seeing the rise in diabetes in young adults. Apart from the genetics, the dietary change, which I call the junk food, has contributed immensely to the rise in the incidence of diabetes in young adults. The unfortunate thing about this is diabetes in young adults most of the times needs insulin injections, which is lifetime rather than the type 2 diabetes where we use oral medication. The hectic lifestyle, the pace of the Gen Z and the younger generation has also contributed to diabetes and other chronic illnesses. It's unfortunate that it's a combination of factors that is now emerging, which is creating a lot of chronic ailments in this population group. And they do not have the time to monitor or do not believe that these chronic illnesses can occur to them.
So, Doc, let's talk about monitoring. How often should our listeners or one have screening for diabetes?
Let's get straight to the patients who are symptomatic. That means patients who are experiencing something. In diabetes, cardinal signs are polyuria, meaning that they pass a lot of urine at night, polyphagia, which means they get very hungry perpetually, and polydipsia, which is they get very thirsty. Now, such patients, they need to take cognizance immediately and get tested as soon as possible. In the normal population group, I would recommend once a year testing in the age group from around 30 to 35, and thereafter twice a year in the age group above 40.
Doc and myself were talking earlier, listeners, about you are what you eat and what you put into your immune system. So, Doc, can you highlight what's the role of diet in managing diabetes?
Diet plays a very important role in the management of diabetes. The common advocacy is a low carbohydrate, high protein, fat diet, aiming to get a fiber of at least 30% per day. Regular meals, at short intervals, early supper plays an important role in the management of diabetes.
And doctor, obviously it all stems from lifestyle changes and making a priority that, we lead a safe lifestyle. And with that said, you spoke about cardiovascular health a little bit earlier on. How does diabetes impact cardiovascular health?
Diabetes results in thickening of the arteries by causing plaque formation. And this plaque formation can occur anywhere in the body and everywhere in the body. The target organs being the eyes, which eventually result in visionary disturbances. It can occur in the arteries of the heart, which eventually can lead to a heart attack. It can occur in the brain, which can result in stroke. It can occur in the blood vessels in the kidneys, which can result in kidney failure. And it can also occur in blood vessels of the feet, which can result in gangrene.
And why is hypertension often called the silent killer?
That's an interesting question and a much ignored topic. It's the signs and symptoms of hypertension are very often alluded to other illnesses. Now, coming back to the primary signs and symptoms of hypertension is headaches. Someone has a headache, passes it off as, okay, I'm having a bad day, or it's stress. Blurring of vision, you'd say, oh, I'm 40 years old, so it could be my eyes. Swelling of the feet, you alluded to, I've had a hard day, I've worked a lot today, so my feet are swollen. So these three cardinal symptoms of headaches, blurring of vision, and swelling of the feet are neglected, and high blood pressure continues until one day suddenly there's an emergency where there's an hypertensive crisis, when it's a bit too late to have picked up by then.
And that's the focus on the show, your listeners. We're trying to prevent, we're trying to treat early. Early diagnosis can save your life. So, doctor, what's the ideal blood pressure range?
The normal blood pressure is 120/80.
And how does lifestyle impact blood pressure?
Hectic lifestyle plays an important role in elevating blood pressure. We should be aware of the fact that whenever there is a stress factor, there is a release of hormones, either cortisols or adrenaline, which causes a flight-fight reaction. This in turn results in constriction of the blood vessels and palpitations, which elevates blood pressure.
So, listeners, mental health and wellness is serious. It is real. If you need to talk to someone, there's medical professionals out there. Get yourself treated, get yourself the necessary help, because you could have an adverse reaction with organ failure, or, as doctor said, stress can contribute to hypertension. And doc, what's the best way to manage hypertension without medication?
It's a dubious question, because I would stand by the fact that treatment of hypertension without medication is not complete. Lowering of blood pressure through alternative means is possible, but the patient has to bear in mind that although lifestyle changes are taking place and patient is actively engaging himself to take care of his health, regular monitoring and medication is important.
And to stay away from those lays and those salty chips.
As I call them,
right?
junk food, restriction of salt, restriction of fried foods, all play a role in controlling the blood pressure. It's the spikes in blood pressure which are dangerous, because it can eventually lead to either a thrombus, which means a collection of blood which blocks an artery, which sometimes can be an important artery in the brain or in the heart, or it could cause a rupture in an artery in an important organ and cause something like a stroke.
So, mums out there, if you're doing your grocery shopping this weekend, please be mindful of topping up on more healthy vegetables and healthy options. So, Doc, let's revisit diabetes. And this is a question from one of our listeners that's listening to us currently. They want you to touch on, they call sugar sores or boils, and how can they be treated, and what can happen if they're not treated.
I omitted recurrent boils as being one of the signs of diabetes. When somebody has recurrent boils, he should, or becomes mandatory for them to check for diabetes. If he is diabetic, or even if he's not diabetic, if the boils start spreading, antibiotic treatment becomes very essential. That's the first thing. The second thing is, Interfering with the boil by trying to drain it at home is highly dangerous. It might go down, the swelling might ease, the pain might ease, but what really happens is it creates a tract where the infection spreads and a new boil forms in another area. So it's important to treat boils timeously.
Listeners, stay with us as we dash for a short break. The silent killers don't wait, and neither your health. We will be back shortly with Dr. Akoo, who is quite knowledgeable with 38 years of experience dealing with TB, HIV, heart failure, hypertension, diabetes, and so much more. Stay tuned.
24/7, 365.
Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD, and now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha, and more. For quality audio experience, now available full range of home appliances. A one-stop shopping experience. Call 031 306 4029 or Kenilworth Park, 202 Brickhill Road, Overport. Simplex Radio, the name you can trust.
This Women's Day, every mosque tells a story. Al Ansar Outreach and Radio Al Ansar proudly present Her Mosque, Her Story.
Join us for an unforgettable day filled with inspiration, delicious food, laughter, comedy, exciting prizes, and heartfelt moments, and get to meet your favorite female presenters.
Tickets are only 300 Rand and every ticket helps support our Slice of Life drive.
Call Outreach today on 031 208 1601 to book your seat for the 8th of August.
Her Mosque, Her Story, because behind every smile, every struggle, every success lies a story waiting to be told.
And remember, she's all that.
ادعو إلى سبيل ربك بالحكمة والموعظة الحسنة وجادلهم بالتي هي أحسن. Invite all to the way of your Lord with wisdom and beautiful preaching, and reason with them in a way that is best and most gracious. Join Shabir Pasha every Saturday at 7 p.m. on the show Dawah Dynamics, and every Sunday on the Dawah Chronicles at 9 p.m. remembering the companions of Prophet Muhammad, peace be upon him. Join the discussion, analyze the lives, sacrifices and contributions of the Prophet's companions, and learn from their experience.
Radio Al Ansar. Doctors and guests on a medical files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
You are listening to a live broadcast from Radio Al Ansar, Pietermaritzburg, 105.6 FM.
ما يقال عندي بسم الله بك نبذ في سلطان جسدي مع السكي يا عين وحدة اللي تسدي تبني شهادة فوق شهادة يا محمد يا سيدي صلى الله عليك نبذ يا محمد يا سيدي صلى الله عليه وسلم يا محمد يا سيدي صلى الله عليه وسلم اللهم صل وسلم طول الدهر على نبينا يا محمد يا سيدي صلى الله عليه وسلم.
Assalamu alaikum wa rahmatullahi wa barakatuh to our listeners on this Saturday morning on Radio Al Ansar 90.4 and Peter Marisburg 105.6 FM. I'm Shubnum Ismail on the Pulse show, capturing the heartbeat of our community. So we have Dr. Akoo on the show, and we are talking silent killers, diabetes, hypertension, TB, HIV, heart failure, and cancer, and how screening and early detection can change your life. So we're moving on. And before the break, Dr. Akoo, we spoke about the wounds and some of the sores the patients might have due to diabetes. Do you normally see the patients at your rooms that might not be treating the wounds properly, that sometimes come to you at a later stage where it's more septicemia, maybe gangrene? And what advice you have for these patients?
The advice would be is to seek early treatment and not to hope that this abscess will disappear on its own, because it only complicates the treatment, it delays the healing, leaves scar tissue behind, and if there are morbid conditions, comorbidities, it aggravates those conditions as well. So yes, early treatment is very important.
In terms of TB, doctor, are you seeing a high prevalence of TB diagnosed cases in South Africa?
Sub-Saharan South Africa has about the highest rate of TB in the world. So yes, we are the TB capital of the world. And early screening is of utmost importance, because TB is a disease that can be treated and completely cured. People should reach out in the event they are experiencing any of the symptoms, because the treatment has become so much more simplified now as compared to the past, where it used to be 18 months long treatment of injections, painful injections, accompanied with side effects. Now, with the shortened DOTS version of treatment, it's just 6 months. Confidently, I can say TB can be cured, especially TB of the lungs. In other organs, it may take a bit longer, for example, TB of the spine, which may take at least 9 to 18 months to cure. But there is hope that it is a curable disease, and there should be no fear.
And doctor, what's the connection between TB and HIV/AIDS?
HIV lowers the immune system of the body, rendering the body unable to cope with any form of infection, whether it's TB, whether it's fungus, whether it's viral. So once the immune system is broken down, it becomes so much easier for resident bacteria or resident viruses to overcome the body and manifest itself in a full-blown disease.
How is TB contracted, and can it be cured with proper treatment?
There is a general myth that TB is contagious. Yes, TB is contagious, but it's only TB of the lungs that is contagious. There are other forms of TB in the body which are not contagious. For example, you can get TB of the lymph nodes, which is not contagious. You can get TB in the lungs, which causes accumulation of water or fluid, which we call pleural effusion. That is not contagious. A patient with TB of the spine or the bones, that's not contagious. So yes, TB of the lung field, the lung parenchyma, that is contagious, and the necessary precautions should be taken. But once the patient has started treatment, 21 days thereafter, the patient is not contagious to anyone around him.
So, would you say the effectiveness of early monitoring, early treatment can actually assist the patient's well being?
Definitely. The quicker the patient starts, the quicker the immune system turns around and starts rebuilding cells that helps in the recovery phase. And the quicker we start the treatment, the sooner the disease is overcome.
Doc, in terms of our heart failure, what are the common heart failure symptoms that you normally see coming to your practice?
At the outset, I would like to make one thing clear. There is a big difference between heart failure and heart attack. Heart failure is a chronic disease. Heart attack is an acute episode. The principal cardinal signs of heart failure are palpitations, swelling of the feet, fatigue, inability to perform normal duties, shortness of breath even at rest or lying down, persistent coughing, wheezing of the chest with phlegm, either white or pink.
Doc, let's revisit our discussion earlier. We spoke at length about blood pressure, but how does hypertension contribute to heart failure?
Hypertension, once the pressure is elevated, you got to understand that the heart is a pump. So when the pressure is elevated, the heart has to pump against an increased pressure in the blood vessels, especially in the feet, the lower limbs. Now, repeated pumping of the heart at an increased rate results in thickening of the heart muscles, stiffening of the heart muscles, and eventually heart failure.
So, how would you diagnose somebody with this condition? And do you do cholesterol screenings? And how frequently should a
The
patient do that?
diagnosis of heart failure can be done clinically and confirmed by doing an X-ray and an ECG, which tells you whether it's a right-sided heart failure, which we call pulmonale, or it's a left-sided heart failure, which commonly occurs in hypertension.
Okay. And can lifestyle changes prevent heart failure? And what's the role of exercise?
It cannot prevent, it can control heart failure. And yes, it does have a place to reduce the incidence of heart failure. But it's important to get medical advice prior to engaging in any physical activity or gym work, especially if you are a known cardiac patient, a known patient with heart failure. Of recent, we've heard of so many super athletes who've pushed on the field of play. And that was because they had underlying heart issues which were not manifest. And because of increased physical activity, they had an acute heart attack or collapsed on the field of play. So it's very important to get advice prior to engaging in strenuous physical activity.
So, how often should an individual visit their general practitioner and just do an observation of their immune system, where they're at?
At least once a year, patients should be assessed both from a clinical point of view and from a point of view of assessing other organs by doing blood tests.
So, Doctor, you're very passionate about oncology and treatment plans. So, which cancers are common in South Africa?
The cancers in South Africa differ depending on sexes. In females, we look at the top ranked cancer as the breast and the cervix. In males, we look at the prostate, lung being number one, the prostate, and colorectal cancer. Colorectal cancer is the third highest amongst the cancers in men.
And how often should women get mammograms?
In patients who have a predisposition to cancer, the earliest mammogram should start at around the age of 30. And if the mammogram was normal, the mammogram should be repeated every 3 years. In patients who do not have any risk factors, the first mammogram should start at around 45 years of age and repeated every 2 years if the initial mammogram was normal. In immunocompromised patients, that is patients with HIV or TB, this mammogram should start at 25 years of age.
Let's go back a step talking about men's health, Doc. June, we just concluded Men's Health Month, but health should be 365 days a year and it should be a priority irrespective of the month. In saying that, mammograms should also be for men. And what message do you have for our men to make their health a priority because they shy away from visiting the doctor regularly until something really obviously goes wrong?
Unfortunately, it is an issue where men tend to avoid doctors in such situations where they have what we call gynecomastia. But it's very important that those patients do seek help and do get a mammogram done, primarily to exclude the incidence of cancer.
And what's the importance of cervical screening?
Cervical screening is of utmost importance. It's now become a national priority, and screening is taking place on a regular basis at all health facilities. Early screening detects precancerous cells long before they can mutate and develop into cancer. You got to understand that precancerous cells are asymptomatic, so the patient is unaware of what's going on. But once the diagnosis is made, early treatment can be rendered and CA cervix can be averted or delayed.
And of course, there's modern technology when it comes to cancer treatment of recent. So the patient can get treated early and have a lengthier lifespan. What's your opinion about the new modern technology and its effectiveness?
It's very effective, and it's really good news that we have such facilities available since cancer of the cervix is increasing, and we now know that we can aim to eradicate cancer of the cervix with this new treatment options available.
So once again, can lifestyle changes reduce cancer risks?
Oh yes, it can. Coming to diet, exercise, healthy living, monogamous relationships, seeking early treatment in the event there are symptoms. As I earlier mentioned, most of the times it's asymptomatic, but if patients are having either menorrhagia, excessive bleeding, or excessive spotting, then screening should be done.
And doctor, what's the role of genetics in cancer?
Genetic Cancer, you got to understand, is a genetic disease in itself. It is mutation of the normal cells which causes destruction of the normal tissue cells. 5 to 10% of cancers are genetically inherited.
Listeners, we are almost to the end of the show. Time for a quick stretch and a breather. We'll be back soon with more insights from Dr. Akoo on disease prevention and how to manage your lifestyle.
Gentlemen, it's back. The legendary Opanankan anti-stress shoe has returned to Brasilia and Designer Shoe Outlet. Handcrafted in Brazil from ultra-soft premium leather, anti-stress comfort, diabetic friendly. Built for real, everyday wear. Tried, tested, and trusted by men from the workday to weekends. Back in limited quantities. Available at Brasilia Pavilion, Midlands Mall, Westtown Square, and Designer Shoe Outlet Westwood and South Coast Mall. Opanankan Anti-Stress. The peak of comfort technology is here.
For over 5 decades, Sunfoil has nurtured a legacy rooted from our land. From a sunflower seed grown with goodness and love, crafted through excellence, precision, and care. Proudly South African and the only 100% pure sunflower oil endorsed as a diamond partner by the Heart and Stroke Foundation. Cook with confidence, serving the best to the people you love, from one dish to the next. Sunfoil, the heart of good cooking.
Hungry for something delicious? Visit the Al-Ansar Deli for freshly prepared meals, sandwiches, savories, sweet treats, and refreshing drinks. Whether you're grabbing lunch, meeting friends, or taking something home for family, we've got something for everyone. Fresh, convenient, affordable. Al-Ansar Deli. Taste the difference today.
This and only this is Nightline. Nightline is the only program that allows you to listen to the opportunity to voice your opinion on any matter or any topic that concerns you. Also on Nightline, we interview the famous, the not so famous, and infamous. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Brother Muhammad Varyawa, and with me in the studio is Dr. Anwar Jiwa. Join us every Saturday night from 8:30 p.m. till 10:30 p.m. on Nightline, the program designed especially for you, the listener. Doctors and guests on the Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al-Ansar will be held responsible for any ill health caused by the advice given on Radio Al-Ansar.
You are listening to a live broadcast from Radio Al-Ansar, Pietermaritzburg, 105.6 FM.
Feels emptiness inside, never-ending rain keeps falling from the sky. Oh, turner of hearts, keep me on the straight path. Don't escalate me to let me walk away. Keep my heart close to you. I need you every day. When I'm lost, can you help find my way? Oh, miss me again. Won't you? Oh, ini esaku kejana. Oh, you're the most that we praise all the time. So many sides, but yet my heart's blind. You're the one, there is no other way. Oh, you're on the straight path. Telling me to let me walk away. Keep my heart close to you. I need you every day. But can you help find a way? Oh, miss me again. Won't you? He's trying to find you. Forgive me, my Lord. Oh, please guide me back. I need you to guide me back.
Assalamu alaikum wa rahmatullahi wa barakatuh to our listeners on this beautiful Saturday morning on Radio Al Ansar 90.4 MB to Marisburg 105.6 FM. You've joined me, Shubnum Ismail, on the Pulse Show, capturing the heartbeats of our community. And we have Dr. Akoo, a general practitioner. We're very lucky to have him. He's got 38 years of experience with us, and we're diving straight back into discussion. We have been talking about diabetes, hypertension, TB, HIV, AIDS, and heart failure. And of course, with his experience on internal medicine, we actually don't feel these diagnoses and these silent killers coming. So no pain, no warning until one day it's too late. So doctor, can you actually tell our listeners about anemia? What is it and why should it be checked?
Anemia is a condition where the hemoglobin, which is responsible for carrying oxygen throughout the body, is low. Now, the hemoglobin can be low due to many conditions. It can be due to TB. You will find that the patient has a low HP. It can be due to chronic kidney disease. But what I would like to stress upon is the undetection of anemia in young women who regularly have their periods, which ultimately causes anemia and is overlooked until one day the girl or the young woman collapses, only then to realize that it was anemia that caused her to be either so lethargic or to have collapsed.
So even if you're donating or considering donating blood, please check your anemia levels.
It's very important. The Blood Association has it as a rule that they check the hepatitis, they check the full blood count before you give blood.
So, doctor, you hear patients talking about, oh, I'm overweight or I'm underweight, but thyroid function, we actually don't speak about this often. Can you obviously enlighten our listeners why it's important to actually check your thyroid to see if it's overactive, underactive?
It's very important, and it's a topic that's not spoken of much. Underactive thyroid is quite common in women, especially above the age of 45, and therefore it should be inculcated as a routine monitoring in such age groups. On the flip side, you have what we call overactive thyroid, and that can occur at any age and can be triggered by any factor. Can be triggered by a physical event like an operation. It can be triggered by stress, and the signs of an overactive thyroid are palpitations, losing weight, loss of appetite, poor sleep patterns, and patients should take note of that and get the thyroid function tests checked.
So, listeners, the point of our show here, the Pulse Show, is to ensure that you make your lifestyle, you make your health a priority. And obviously, early detection is crucial to prevent these diseases that Dr. Akoo has been speaking about, the silent killers that we've actually touched on, hypertension, HIV, as well as your cardiovascular, etc. So, doctor, what's the best way to get screened for these conditions?
The best way is to have a complete blood test at least once a year in the age group starting from 40 to 45. In those who are predisposed to any chronic illnesses like diabetes, thyroid diseases, family history of thyroid diseases, family history of breast cancer, they should be screened by having full blood counts done, having a complete blood profile done at least once a year.
So, Doc, let's talk about our lungs, another very important organ. What's the impact of smoking and how it also contributes to our disease management and our lungs?
It contributes a lot to the destruction of the normal lung structure, which ultimately results in diminished vital capacity, which then leads to shortness of breath, which then becomes chronic. It can, in some instances, or in quite a few instances, lead to cancer of the lungs. Therefore, smoking is a high risk and should be not taken too easily as something that is not dangerous.
Doc, as a general practitioner in the city of choice, any tips you have for our listeners on staying healthy and what comes to mind at obviously in terms of guidelines and treatment?
Can I be blunt?
Sure, go for it.
Stop buying over-the-counter meds on a regular basis and get a physical checkup to establish the cause of your problem. Stay away from junk food and preserved foods. Regular exercise, hydration, and good sleeping pattern. Quick fixes only delays diagnosis and increases mortality. Use Google responsibly. Moderation in everything is vital.
Wow, that's 38 years of experience with Dr. Akoo. Listeners, I hope you've been mindful and taking notes. Doctor, obviously you've evolved, you've traveled a lot, you've been through many conferences. There's been many updates with healthcare and innovation and interventions. What is your thoughts about the new technology and are you excited about the future of healthcare?
Yes, I'm very excited because I've been through a phase both during the HIV pandemic. Just to walk you back, the HIV pandemic in 95, 96, we used to have wards full to capacity with about 90 to 95 patients. And at that time, HIV therapy was not available. And you do a ward round in 5 minutes because there's absolutely nothing at that time you could offer the patients. So with the advent of new technology, new treatment, new modalities, it's exciting, it's interesting, and hopefully it will lead to better treatment management and better quality of life amongst patients.
Dr. Akoo, Jazakallah so much for being with us today, and to all the doctors, medical professionals out there that is touching lives every day. Thank you for sharing your expertise. Any final words, and how can our listeners get in touch with you, and where you're located in Pietermaritzburg?
I'm located at 189 East Street, that's opposite the Midlands Medical Center. My cell number is 082 755 987. My landline number is 033 3461 449.
Listeners, we've talked about the silent killers, diabetes, hypertension, TB, HIV, heart failure, and so much more. So this message is clear. They don't have to be silent if you screen early. Prevention and early detection really do give you back your quality of life. Also remember, due to school holidays, there is really an extreme shortage of blood stocks. Give the gift of life and please make a donation this coming Monday at 301 Burger Street, Pietermaritzburg, between 12 to 3. Remember, uncontrolled hypertension, diabetes, etc. can also lead to stroke. For those stroke patients, their families, and survivors, I'm hosting a stroke support group on the 21st of July. So get in touch with myself, Shubnum Ismail, 082-360-2590, and we can get in touch with you and walk the journey with you. From my end, shukran for listening. Take care. Don't ever put off your BP check, sugar test. Screening starts today. It's the one life you've got. Jazakallah to our technicians, Bo Durban, Peter Marisburg. Save the date for the next Pulse show next week, Saturday, inshallah. From my side, shukran. Assalamu alaikum wa rahmatullahi wa barakatuh.
Pulse program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
Radio Al Ansar.